The reason I got into parasites and parasitology is it fascinated me. I enjoy teaching what parasites do. Students are enthused about it. Yeah, it takes time, and you have to spend a little more time at work than some people have to spend at work, but look at here, I get the opportunity to come and talk to people like you and to audiences like at the Western Veterinary Conference. I get to go around the world and work with scientists who have the enthusiasm and interest that I do. Who wouldn't want to do that? We're working with mosquitoes a good bit now because of heartworm and because of resistance to certain heartworm preventives. But we raise fleas. We do a lot of work with ticks. We do a lot of work with intestinal parasites. We do a lot of work with intestinal protozoans. So our program is quite diverse. But right now, I would say 15 to 20% of our effort is, maybe a little bit more, is involved with mosquito research. Prevention. Use of preventive products, number one. Number two, testing. Testing annually. Testing everybody that you can annually. And then tailoring product selection to client capability and pet habit. And that might be topical, it might be oral, it might be injectable, it might be every 6 months, it might be once a month. So prevention and testing, I think, are the two most important things. If I were to add a third, I would say adjuncts to those two methods of heartworm prevention. That is education, understanding things like how heartworm is transmitted and how we can mitigate transmission by our behavior. I mentioned in other lectures screening in kennels to exclude mosquitoes, using products since you have to control fleas and ticks. Use those products that also have claims against mosquitoes. We can't count on them in preventing heartworm infection 100% of the time, but when you combine compliant prevention, you combine habit in terms of the way you interact with your pet in the environment, and you use these other modes of prevention of mosquito attack, then your chances of preventing heartworm infection increase markedly.